can make a bigger cutware.
On veut les 100 cl, on en veut 30. 30 100 cl.
Regarde le four que j'ai trouvé, c'est un peu quand même.
16.
In November 2012, a group of volunteer doctors and nurses prepared to leave Montreal for Burkina Faso, West Africa. They were about to embark on a medical mission to treat women suffering from obstetrical fistula. The mission was organized by the MMS Foundation, or Healthy Mothers of the World, headed by Montreal urologist Dr. Jacques Coq.
Ils vont prendre une caisse de plus. Au départ de Montréal, vu qu'on est sur Air Canada, ils vont les enregistrer jusqu'à Ouagadougou. Ok, bon, on arrive cet après-midi, il n'y a pas de problème.
Is this your first mission to Burkina?
I've traveled in Africa before, but it's my first medical mission.
Quand tu étais là à la première heure.
Boromo is a small town 2 hours from the capital city of Ouagadougou. Every year, the MMS Foundation medical team conducts 2 surgical missions at the Boromo Medical Center, which has an important vocation in maternal health. During the week-long mission, the team would treat 20 women from across the country.
Les missions qui arrivent ont été beaucoup plus médiatisées. Sur l'étendue du territoire burkinabé, toutes les femmes ont un point de convergence pratiquement, c'est Boromo. Surtout que la prise en charge ici est totalement gratuite pour toutes les femmes. Des gens qui sont très éloignés de nous viennent à notre secours pour aider vraiment ces femmes qui sont souvent dans des états vraiment très déplorables.
Obstetrical fistula is a hole between the bladder and the vagina, or the rectum and the vagina, leading to a leak of urine or leak of stools into the vagina, and obviously an extraordinary uncomfort for the mother. The head of the fetus is going blocked between the sacrum posteriorly and the pubic bone anteriorly. The consequence of that is the rectum that you see here in brown, or the bladder that you see here in brown, become squeezed between the hard head of the fetus and the hard bone of the pubic bone. And this bladder is going to be squeezed there for hours or days, leading to a hole, and the hole is going to provoke the leakage of urine into the vagina. The anterior wall of the rectum could be compressed enough to lose its trophicity, its vasculature, and then you have the leakage of stools going down into the vagina of the mother.
At the start of each mission, the MMS team conducts diagnostic examinations with the help of a local midwife.
Ça fait 17 ans. Ah, ça fait 17 ans. Sommes jusqu'au 25 novembre. Ok, comment elle va, elle, ça va? In comparison to what we see in our countries, in these countries, because the lack of facility, a lack of trained personnel, a lack of easy mobility for the patients, very often these deliveries are prolonged for hours or days. Sometimes it's several days. Est-ce qu'elle a des fuites actuellement?
Elle n'a pas de fuite.
She's not draining anymore through the catheter. She drains everything through the vagina. Most of the time, these fistula are seen in people living in remote places, far from any medical centers, and far from any place where you can do a C-section. Another common cause in Africa is the young age of the mothers Very often they get married around 13, 14 years old, at an age where the pelvis is not ready for a pregnancy and a delivery. And the lack of elasticity of this pelvis lead to all the consequences, the difficulty for the baby to go through the pelvis, which is not completely formed. Also, the family reticence to send these young mothers to a medical center. As you know, it's a very patriarchal society where the husband has to give his okay, and very often even if the husband agree, he still has to go and get his father permission to send the mother to a medical center. All of that obviously create delays, and because of these delays, all these catastrophes occur.
After diagnosis, the surgery begins at the rate of 2 to 3 cases per day, depending on the complexity of each case. Dr. Alfred Omze trains members of the hospital nursing staff in the techniques of anesthesia. Training in fistula surgery is also provided to doctors from Burkina Faso.
The correction of fistula requires a relatively well-trained team. When you show the hole between the fistula and the vagina, it's easy to explain that we just have to close it. In real life, it's much more difficult. First of all, the size of the fistula in these countries is huge. We're talking about several centimeters holes between the bladder and the vagina. Very often, there is a scar around the fistula, making the tissue of poor quality. There is chronic infection, which is very common in this patient. Most of these surgeries are done through the vagina. We don't have to open the abdomen in most of the cases. We have to dissect around the fistula to close it. We cannot put any kind of artificial meshes. We have to use only the tissue of the patient. The result of this difficult surgery is a high rate of recurrences. Some patients get 3, 4, 5, 6 reoperations before they can be closed. And each surgery is more difficult because you're working with more scar and more local lack of elasticity, which makes things much more difficult.
Some fistula patients require further interventions, and the women must return to the hospital in several months' time. After surgery, women remain hospitalized for about 3 weeks before returning home.
Montrez-moi la douleur. Montrez-moi. Jimmy. Tout est bon. C'est vraiment stable. Peut-être ça va rester comme ça dans le lit pour la soirée et la nuit. Et demain matin, elle va commencer à marcher et aller partout. Et elle peut manger légèrement ce soir, si elle veut. She's the lady that's been having all kinds of other problems too. Not feeling well.
Le médecin l'a vu hier, il pense que c'est un palu.
Qu'elle prenne maintenant. Maintenant qu'elle prenne ça et ça.
How did the second surgery go today?
Went okay. She had a lot of scarring, and she said she hadn't had previous surgery, but she's had previous surgery of some sort because it was all deviated, very thick scar. But the fistula was fresh, it was okay, and she should do fine, I hope.
Bon, notre journée est finie, la journée opératoire est finie, mais pour faire la vaisselle, quand le repas était bon, c'est la rançon de la gloire.
Premier cas ce matin.
Tout ça?
Il nous reste à faire le deuxième cas par la suite.
Ce matin, on a commencé un peu plus tard. C'est sûr que finalement, sur les cas que l'on a à date, qu'on en a vu, on n'a pas vu de grosses catastrophes qui vont nous prendre des 8 et 9 heures, comme ça nous est arrivé l'an dernier. Si on peut faire 3 cas par jour, on les fera.
Moi, je suis absolument agréablement surpris et satisfaite et heureuse du fonctionnement de la journée. Un super beau travail d'équipe, puis on peut compter un sur l'autre sans même avoir à demander rien.
Pat?
Très bien passé, les 2 patients sont récupérés très bien.
The patients are living quite far. So if you decide to leave the catheter 3 weeks, normally they have to stay 3 weeks in the hospital.
Right.
Which is really
That's a burden.
It's a burden for them because they have to be far from their families or kids and everything.
Tomorrow we'll change into a leg bag probably.
Drain, drain, drain. But that's not kosher. So yes, anything that they can drain on a regular basis, but not a full bag.
Donc si j'ai bien compris, là tu vas, demain ou après-demain, là tu vas commencer à faire les interviews toute seule, directement dans la langue de la patiente.
Je fais en français ensuite et dans la langue et je reprends en français.
Et tu reprends en français, c'est ça.
Concurrently with medical treatment, the Foundation has been conducting participative research on the experience and needs of women living with obstetrical fistula.
Se rencontrer pour parler de l'étude qui va se faire au courant de la semaine avant vos interventions chirurgicales.
In West Africa, there is absolutely no long-term study following women that are operated from obstetrical fistula. He was trying to understand not only if the surgery was successful, but also if the women were able to reintegrate fully their community.
Combien de grossesses elle a eu au total?
So in the first phase of the research, we do a 1-hour interview with each woman prior to the surgery. We talk with the woman about her experience of living with a fistula and how the fistula is affecting different aspects of her life.
Avant de tomber malade, elle vivait avec son mari, elle n'avait pas de co-épouse. Mais maintenant, comme elle est tombée malade, son mari l'a laissée, il a pris une autre femme. Après l'accouchement, quand il y a eu les pertes, il pensé que c'était normal, que ça allait passer quelque temps après. Mais quelque temps, ça n'est pas passé. Donc, ils se sont renseignés encore, on a dit qu'on pouvait soigner ça ici.
A majority of the women went back to with their husband, and even some of our women got a new pregnancies. So that's really good results. Some of the women were rejected by the husband prior to the surgery because of the fistula. For those women, the story can be a little bit different.
Jamais opéré pour la fistule.
Là, ouais, il pas tant de temps pour opération.
N'y a pas de temps pour opération.
La quand on est là.
Nane ka gomi point hainde.
Bumu unze to atu ba ni ko hanti ya wani ba suka to. Ni ba tan ko lofo. Ti ko ya walma.
Some of these women go back with their husband, some of them don't, and we have examples of women that have remarried with a new partner, and we also have histories of women who decided to stay alone and rest after their surgery.
Vraiment d'entendre les femmes, chaque femme en parler au niveau plus personnel, c'est sûr que c'est touchant. On veut savoir dans le fond si ça affecte les relations avec son mari.
Son mari. Yam kali son itaba, yam kali chen itabia bo.
Ba so bratin of na sape. Don't you pinda?
Katoi.
Ai, toi.
Ya toi.
Tu fu menga se nam soy. Bumbo bamba ne ti bumbo bana yeso ma ya. Tu ma menga la bamba o ba ya kai. Sule pa to en basan ba dali. Dani en fum la ne ba balan la dan ka.
Sino fu suna menga.
Ti bilan yeti ti ge he on la ya ba ka na ma no. Papa fine ni jo ti ba wen dare ba be ba me. Na ngom de ba ya ala le ba mi be ba me.
1 year later, We go directly in the woman's community in her own village, and we ask her about the experience following the surgery. So we want to know how the surgery went, and we want to know about the reinsertion process. So most of the women were able to reintegrate the social community, their family. Most of the women were able to go back to the marketplace to reintegrate into the economic world. Even some of the women started new businesses they weren't doing before the surgery. So in terms of economic reinsertion, that was really good too. We're trying to use these results to implement a reinsertion program that are going to be what women really want in terms of reinsertion and what they really need.
Dans la salle d'opération, c'est vraiment impressionnant pour moi de voir ça.
Drink a lot.
So give her something to eat and give her the Tramadol and the Tylenol. Right? Yeah, so.
To over 120 or so. So I'm just going to check it now and see how she's doing.
She had a complete rectal disruption, so she couldn't hold stool. So we reconstructed the anal sphincter and reconstructed the distal vagina and the perineum. So she's having no bleeding, no pain, and she's able to urinate, so we'll go ahead and let her go home. Très bien. Oui? C'est vrai?
Je vais te donner 3 pilules.
It's important for her to drink a lot. 2 bouteilles d'eau par jour.
Trois semaines de patience et puis il y a encore de l'espoir.
The economic was difficult for most of these women. They accumulated a lot of debts related to their surgery. So we started to help those women, and we provide the money for the transport, for the food when they are at the hospital. And when we compare the women that we interviewed 3 years ago with the new interviews, what we can see is they return to their community with a debt that is really less than the other women, and the reintegration is really better.
The end of each mission is always an emotional moment. The women are sad to see the team leave, but hopeful they will regain their health and once again be able to lead a normal life.
Let's go on the table, please. Allez, et au revoir. Bye bye. C'est quoi? Bye bye. Bye, c'est bye bye un jour.
Allora puis là e bi mo la ju on va treba azinando na awurba baba no se pla pe no da bi se pla pe adada na ban bal na su ya yele ban pe